We are delighted to have Maria Parker here today. Maria is a clinical nurse specialist and psychotherapist with keen interest in mental health supports in schools. Maria, thank you so much for joining us today.
Thanks, Aisling.
The approach to mental health in the Irish school system in Ireland must be improved. Student and parent voices are missing from this vital discussion, and therefore I'm creating this video podcast series to interview students, parents, past pupils, and those who wish to advocate alongside our voices in order to strive for change. Tell us a bit about yourself, your background, and why you wanted to get involved in the Mental Health in Irish Schools Transition Year project.
Thanks, Aisling, for having me. I suppose I just want to start off by saying how proud you and your mum should be of all the work you guys are doing in this, because it takes young people's voices to be heard and to push this. So I just want to start by saying that. So yes, my name is Maria Parker. I qualified as a mental health nurse in 2003. And I went on to work for about 18 years then in child and adolescent mental health as a clinical nurse specialist. And more recent years, I spent my time in the emergency departments in our children's hospitals, both children's hospitals, working with acute mental health presentations. In 2015, then I qualified I went back to college for 3 or 4 years, went back and trained as a psychotherapist, so working from very much a humanistic approach. So I suppose just in terms of school and mental health and school counselling, I support this so fully. Going back probably 17 years, a year after I started in child and adolescent mental health, I could see the need for early intervention, and I couldn't understand why I was just seeing young people at the acute end where they were in dire need of support. So I was always wondering what was happening in our schools, why aren't we in our early intervention stages? And working in the emergency department then, I've seen it, and from the years 2006 to 16, I think it rose 500%, the presentations. So there's something big going on out there.
Yeah. How do you feel the approach surrounding mental health has changed since you were in school?
I suppose, and when I went to school, and I've no bother saying I'm now 41, we had no knowledge really of anything mental health wise or mental health programs, which is unusual given the fact that I decided to go into mental health nursing. But we didn't have anything. I think there's a lot more awareness now, but I still think there is a gap. I think there's a massive gap. You know, I think we're sending out information to schools, we're sending out information in social media and public, here are the numbers, get in touch, but we're missing the human to human contact. So if you send out leaflets, it's brilliant to send out the leaflets and support leaflets to schools. But for a young person to go and pick up the phone, then I think that's really hard. I feel that in schools, having somebody there in a particular space every week, be it 1 day a week, be it 5 days a week, from that work has a mental health background, I think the support of that would be phenomenal. And it's early intervention is where it's at. We don't need young people on waiting lists for years becoming unwell. Yeah.
Please tell us more about the therapeutic peer support group you've decided to run for 5th and 6th year students and where people can find it.
So the peer support group came out of a role I'm currently working in. I'm working as a counsellor in a further education college on 1 day a week. We've over 1,000 students. So I felt the need to support the students when we went into this lockdown. I knew that morale was low. So I advertised it literally 1 day, came up with it, decided I'm going to do a therapeutic support group, and it was full within a day. And I'm glad to say that it continues to run. It's amazing. And the young people that are in the support group are just phenomenal. They're from ages, what age is that? Up 17 upwards, up to 30 at the minute. But I'm breaking it down now to school age groups. So it's just the developmental period of 5th and 6th years, young people. It's a stage where they want to interact with peers. They're thinking about their own identity. They want to connect with others, not necessarily their parents. And they want to connect with each other. So it's a space that offers support for that. But not only that, we're offering loads of information on coping mechanisms, coping styles, finding out that other people are feeling the exact same way as you, and that it's normal and that it's okay. and we have some fun as well. It's really, really, really good fun as well at times. And it is one of the highlights of my week at the moment, running that group, and I love it. So it is going to be opened up to 5th and 6th years, and they're going to be running throughout the rest of the year, throughout the summer as well. I think it's hard sometimes at the minute because students are struggling. We don't know about the leaving cert, what's happening, So if anyone wants to is interested in, please get in touch. I'd be more than delighted to help you.
How do you feel we can further this conversation and make more changes in Irish schools?
I have a little thing here because I don't want to miss this one. I think the furthering the conversation, government listens to cost effectiveness, hopefully. It costs in and around €1,000 a night for a young person to be admitted into hospital. Yeah. For me, that is just, it does not make sense when I know from working in the emergency department, I meet young people, and in my head, all I think of, they have been on a waiting list for a year. The work that could have been done, it could have been so easy to meet somebody for 6 weeks period, support them, validate them, and help them, the changes it could have made. But instead, deterioration has occurred over a year, possibly in admission then or out into our CAM services, and the cost of that. Yes, it's costly having counsellors in school, but to me that's irrelevant. But that's just me, because the benefits way outweigh the risk. I think the classes in terms of emotional intelligence and working with young people from primary school upwards, telling them, explaining what their feelings are, validating them, explaining what other people's feelings are, and making them normalizing feelings. Not everything is a mental illness or mental health problem. It's just normal feelings that we don't understand. Yeah.
How do you mind your own mental health and well-being, especially now in the time of a pandemic?
It's a lot easier in this lockdown, but the first lockdown was really, really tough, and we struggled working from home, working with having 2 small kids, age 4 and nearly 2, but they weren't at the time, and they were younger than that, of course, a year younger than that, so it was really hard. So I had to work hard to put things in place, see what worked for me, structure, timetable, taking space, taking half an hour in the day to get out for a walk, to get out into the air. And the top things, sleep, nutrition, social media, phones, putting a plan in place for yourself. I honestly cannot say how important that is for everyone out there to do that. And you will reap the benefits of it. And yeah, I think structure is the main thing. And that's what a lot of young people are lacking at the minute. Studying from home, we cannot expect people to just be able to just concentrate and study all day on a computer and just work. It makes no sense. It's another thing that makes no sense.
As part of the Mental Health in Irish Schools Transition Year project, I have started a petition to highlight the lack of mental health supports in schools and to ask the Irish government to provide a dedicated mental health support service for Irish schools. The petition draws on the Irish Association of Counselling and Psychotherapy commissioned National Crisis Survey in March of 2019, in which 9 in 10 Irish adults strongly wished for therapeutic counselling to be made in all schools in Ireland. Why did you sign the petition?
Because I agree with every single person, the 9 out of 10 people, that counselling should be available for every young person. And drawing on my own 20 years experience in mental health and my experience working with 17-year-olds upwards in further ed in the counselling, the benefit of being seen, being heard and being validated is priceless. And that is all people need. All people need is to be seen. Of course, there are more things, but not every single person has a diagnosis of a mental illness. They're just struggling, and we need to normalize that piece. And this too shall pass. This will pass. But now is the time, and it's young people's voices that need to get out there. And it's working with young people that I just love their enthusiasm, their ability to say it how it is. And get heard.
What is a message you'd like to share with the people watching this interview?
Yeah, I suppose the most important thing, I think, is that this will pass, that things will get better. We will get out of this. And we can guide our minds as to how we look at it. You know, we can get into a place where we're really stressed and really anxious and we're feeding that anxiety, or we can pause and stop and just take a break. If you decide to take a day off from study, do it. Don't feel bad all day about it, because it's pointless. Take the day off, take the time, and take the space that you need. Do what you need. The other thing is, if people are struggling, talk to your parents, talk to them, just say it. They don't have to, nobody has to, you know, have an answer. Sometimes it's just being able to verbalize it, being able to say it out loud. I'm really struggling today, and find that support. Yeah, I think that's the main thing. And just, yeah, highlighting again the importance. It's hugely important, especially given the COVID and what we've gone through in the pandemic.
Maria Parker, thank you for showing your support towards my mental health in Irish schools transition year project. Your time, words and support towards the mental health of young people in Ireland is valued and appreciated.
Thanks a million, Aisling. Thanks so much.